I'm Dr. Shoaib Ismail. I'm one of the neurology registrars at King's College Hospital, London, and in this video I'm going to be telling you about the use of artificial intelligence software packages in the interpretation of radiological images in hyperacute stroke. So let's get started. First of all, let me open the PowerPoint presentation that I've prepared in order to tell you about this. So here it is. So let me bring it to full screen. Artificial intelligence is becoming increasingly more used in the interpretation of CT head, CT angiogram, CT brain perfusion studies in hyperacute stroke. Now, hyperacute stroke requires immediate management because time is brain. Every single second that passes increases the chance of the patient having disability. So this is the reason why we want rapid interpretation of the radiological images, and artificial intelligence helps with that. The artificial intelligence softwares that I'm going to be talking about in this particular presentation include Brainomix and Rapid. Now, I have no disclosures whatsoever. I'm not paid by any of these software companies. The only reason why I'm discussing about these two softwares is because I've used these two softwares. I previously used to work at Kent and Canterbury Hospital, and the software I used over there was Brainomix, and now I work at King's College Hospital, and the software I used over there is Rapid. It is not a tacit endorsement of these two softwares. It's just that these two softwares are the ones that have been at my disposal. So let's start with what is artificial intelligence. Artificial intelligence is actually intelligence demonstrated by machines as opposed to natural intelligence displayed by animals, including humans. It is the study of intelligent agents. The concept of intelligent agents is crucial to understanding what is artificial intelligence. An intelligent agent is anything that perceives its environment and takes actions that maximize its chance of achieving its goals. In other words, it is anything that perceives the environment and takes actions autonomously. Now, this is an important word, autonomously. Artificial intelligence software packages take their actions autonomously. They are not specifically instructed to do one particular task. Like, for example, in case of computer programming, you write a computer program or you write a computer algorithm and you specifically instruct the computer algorithm to perform a particular task. This is not the case in artificial intelligence. The computer program is not specifically instructed to do one particular thing. Rather, it comes up by itself on its own with what to do. It knows that this is the input that has been fed to it, this is the desired output, and then it comes up by itself with what to do. And then there's another important aspect that you need to be aware of, and it is the fact that artificial intelligence softwares learn from their own mistakes. Let's say that it comes up with the wrong answer, then this mistake is fed back to the artificial intelligence software and it learns from its own mistakes. Basically, artificial intelligence softwares have something which is known as a cost function. Now, cost function is a mathematical function that keeps track of all of the mistakes that it has made, and every time it makes a mistake, it is penalized. The cost function goes higher, and the artificial intelligence software algorithm is programmed to keep the cost function to a minimum. So if it makes a mistake, the mistake is fed back to the artificial intelligence software, and the artificial intelligence software modifies itself. Now, what does it do? You don't know what it does because you have not specifically programmed it to do something. You have only programmed it to learn intelligently by itself about what to do. Machine learning. Now, machine learning is a tool that is used very commonly in artificial intelligence. Machine learning is the study of computer algorithms that improve automatically through experience and by the use of data. So machine learning is about taking intelligent decisions and learning from the data. So it is considered to be an extension of statistics. Machine learning algorithms also learn from data, operate on data, but they operate in an intelligent manner. They modify themselves. They learn from the data that they are fed. So this is a diagram that illustrates what I was talking about. As you can see over here, that the concept of traditional programming or conventional programming is that you write a computer program and the computer program takes the input, does some computation on it and churns out some results. Whereas contrast it with machine learning, in which you don't write a computer program that does a specific task. Instead, you write a computer program that decides automatically about what to do. The computer program is given an input and the desired result. It is told to come up with what to do by itself. So so that this particular result can be generated from this input, and the computer program thinks in an intelligent manner, comes up with what to do, and if it makes a mistake, then it is fed back to it and it modifies itself. Here is an example of a neural network. Neural network is one of the artificial intelligence software tools. You can see over here that neural network consists of different nodes and internodes. It has these connections between the different nodes. Neural network is actually inspired by the concept of human brain, but is not a physical brain. It is virtual. It is inside a computer. It is part of a computer algorithm. Now, these are pieces of software that interact with each other in a manner which is similar to the working of human brain. Now, these nodes are arranged in layers. Now, the first layer of the nodes takes the input data. Now, in this particular case, the task that we are interested in is that we are going to feed an image to the neural network, and we are going to find out whether this image is the image of a cat or it is not the image of a cat. So the neural network has been designed to distinguish between images of cats and images which are not cats. Now, an image is actually a grid of numbers because an image is made up of many different pixels, and every pixel is a number on a grayscale from 0 to 255. If it's a colored image, then every pixel is actually a combination of three numbers, one representing how much red is in that pixel, one representing how much green is in that pixel, and one representing how much blue is in that pixel. So all of these numbers are fed into that matrix of numbers is fed into the first layer of the neural network, and then the neural network operates and analyzes that image. What happens in the inner nodes of the neural network, you don't know exactly. It is sort of like a black box. It comes up with a solution by itself. It comes up with a method of distinguishing between cats versus images which are not cats, and then at the end it churns out a result. I think it is cat, or I think it is not a cat. And if the result is wrong, then this is fed back to the machine learning algorithm, and the machine learning algorithm modifies itself accordingly. Some examples of artificial intelligence in daily life, these include advanced web search engines, for example, Google. You might have noticed that when you are performing an internet search, let's say you're searching something in Google, Google acts in an intelligent manner. It sort of predicts what you're going to type. What you're going to search next. The recommendation systems used by YouTube, Amazon, Netflix, when you are browsing Amazon Prime, for example, it kind of knows in an intelligent manner what you're going to buy next. There is a very smart artificial intelligence software embedded into the Amazon interface, embedded into the Amazon website, and it is able to predict what you're going to do next. And it shows you only those items that you're likely to buy, thereby increasing the sales of Amazon. Same is the case with YouTube, and same is the case with Netflix. They have a way of predicting what you are going to click and which video are you going to watch, or which film or which TV series are you going to watch. Similarly, understanding human speech such as Siri and Alexa is also an example of artificial intelligence, because Siri and Alexa have not been programmed with specific speech sentences. And if you think about it logically, the total number of combinations of sentences that a person can speak is endless. It's infinite. Moreover, speech has different intonations and mood and other tonal variations that are very difficult to program specifically. This is the reason why Siri and Alexa rely on machine learning technology to interpret human speech. Moving on to self-driving cars, for example, Tesla. These also make use of artificial intelligence because every route and every obstacle faced by a self-driving car is different and unique and requires individualized action, automated decision making, and competing at the highest level in strategic game systems. For example, computer algorithms that play chess better than even the world champion are also examples of artificial intelligence. This is a diagram that illustrates all of the different applications of machine learning and artificial intelligence in everyday life. And you can see over here that machine learning is used in medical diagnosis, in stock market trading, in online fraud detection, in virtual personal assistants such as Siri and Alexa, in distinguishing spam emails versus non-spam emails, in self-driving cars, in product recommendation systems such as the ones used by Netflix, Amazon, and YouTube, in traffic prediction softwares, for example, traffic prediction in Google Maps, in speech recognition systems, in image recognition softwares, and image recognition softwares are relevant to interpretation of radiological images in hyperacute stroke, so we'll be talking about them in more detail. So now that I've told you some of the basics about what artificial intelligence is, I'm going to now move on to the role of artificial intelligence in the setting of hyperacute stroke. First, I'm going to tell you about the challenge that we're trying to solve. There are more than 100,000 strokes in the United Kingdom every year, and over 1.2 million stroke survivors. It is one of the leading causes of disability as well as death in the United Kingdom, and also in the rest of the world. It is the fourth single leading cause of death in the United Kingdom. So it has huge costs to the healthcare system, not only in terms of direct costs involved in treating patients with stroke, but also in terms of indirect costs to the economy as a result of unemployment and lost work and therapy and rehab related costs. There is a huge potential of savings in the NHS if thrombolysis and thrombectomy are offered in a timely manner and patients are saved from disability. Then this has a potential of £800 million of saving to the NHS, and these treatments of thrombolysis and thrombectomy need to be administered in a timely manner because time is brain. With every single passing second, lots and lots of neurons are dying, and so thrombolysis as well as thrombectomy need to be offered to patients very fast. As they say, time is brain. Now, how would it be possible to offer these treatments in a timely manner? By transferring the patients rapidly to the hospital, by making sure that the patient receives a CT scan soon, by making sure that the CT scan is interpreted as quickly as possible, and by taking decision on the basis of the findings of CT scan very quickly. As you can see over here, that rapid interpretation of the radiological imaging, that is rapid interpretation of CT head, CT angiogram of the aortic arch, carotid and vertebral arteries, as well as intracranial arteries, is extremely crucial. And so this is a schematic of the pathway. The patient develops a stroke, by which I mean the patient develops fast positive symptoms, that is either facial droop or asymmetry or facial weakness, arm or leg weakness or slurring of speech. Then this is the time to call 999 in the United Kingdom. The ambulance paramedics arrive, the patient is taken to the hospital. As soon as the patient arrives in the hospital, you take a quick handover from the ambulance paramedics in 2 to 3 minutes, and then after that you try to take history in the next 2 minutes, and then you rapidly perform the examination. The most important examination that you perform is the NIHSS, which is the National Institute of Health Stroke Scale. It takes about 5 minutes to complete that. In the meanwhile, the nurse is busy passing an IV line and taking bloods. So the bloods have been taken, the history or handover has been taken, and NIHSS has been performed. Immediately after that, the patient is rushed to the CT scanner. After the patient has had CT head as well as CT angiogram of the aortic arch, carotids as well as vertebral arteries and intracranial arteries, then the decision about whether to thrombolyze or not is made based on the history as well as on the findings of the CT scan and the CT angiogram, because in order to be eligible for thrombolysis, there should not be any bleed and the patient should be within the 4.5 hours time window. And if the patient is eligible for thrombolysis, then the thrombolysis is administered straight away. If not, then the patient might even be eligible for what is known as a mechanical thrombectomy. The time window for mechanical thrombectomy is larger than that of thrombolysis. Thrombolysis can be administered only in 4.5 hours since symptom onset, whereas mechanical thrombectomy can be offered even up to 24 hours, depending on dawn criteria, extent criteria, or diffuse criteria. The patients who are most suitable for mechanical thrombectomy are those patients who have large vessel occlusions in either the internal carotid artery or the proximal middle cerebral artery on CT angiogram. And then CT perfusion studies also show that there is salvageable brain tissue in the form of penumbra. That is, the difference between cerebral blood volume and time to peak is quite significant, and this represents a significant salvageable penumbra that can be saved by performing mechanical thrombectomy and retrieving the clot. This is a graph that shows the variability of manual aspect score. Aspect stands for Alberta Stroke Program Early CT score. It is a score for interpretation of CT head in the case of hyperacute stroke. Let me explain the aspect score to you. For the purpose of aspect score, each cerebral hemisphere is divided into 10 different areas, and if all 10 of those areas are normal, then the aspect score is 10. With each of those 10 areas becoming hypodense, you reduce 1 point from the aspect score, so that if 4 out of the 10 areas are involved and are hypodense, then the aspect score would be 6. These 10 areas include head of the caudate, internal capsule, putamen, claustrum, as well as 6 different areas of the MCA distribution. The aspect score is heavily biased towards the MCA artery territories. It does not take into consideration the areas of the brain supplied by the anterior cerebral artery or the posterior cerebral artery. Now, this graph tells the results of interpretation of CT scans of 3 different patients by 300 physicians from 10 countries. The green bars represent the actual aspect scores of these 3 patients. The actual aspect score was determined by using the MRI diffusion weighted imaging. Now, as you can see over here, this first patient had an actual aspect score of 4, but some physicians said that it's 10, whereas some physicians, a very tiny proportion of physicians, even said that it is 1. An aspect score of 10 means that the brain is absolutely normal with none of the areas involved, whereas the aspect score of 1 means that there is an extensive stroke, so that almost the entire cerebral hemisphere is involved. Only 1 out of the 10 areas is unaffected. Similarly, in this patient, you can see that the actual aspect score is 8, but once again, as you can see over here, about 80 out of the 300 physicians said that the aspect score is 8, which was the correct answer, but some said that it is 10. A very tiny proportion of physicians said that it is 2, meaning that they consider the stroke to be much bigger than it actually was. In case of the third patient, the actual aspect score was 3. It was quite an extensive stroke, quite a large stroke. 7 out of the 10 areas were involved, but some of the physicians said that the aspect score is 10, meaning that the brain is entirely normal and there is no stroke, and some said that the aspect score is 0, meaning that the entire cerebral hemisphere is involved. So you can see over here that there is a huge variation in the findings of manual interpretation of CT head in the setting of hyperacute stroke. This is the reason why artificial intelligence is helpful in the interpretation of CT head, CT angiogram, as well as CT brain perfusion studies in hyperacute stroke. The artificial intelligence softwares that are commonly used in the setting of hyperacute stroke include Brainomix, Rapid, Singo.via Frontier, Avicenna AI, Wiz.ai, ADOC. As I've already told you, I'm not being paid by any of these software companies. I'm familiar with Brainomix and Rapid because Brainomix was used in the previous hospital I worked in, and Rapid is used in the current hospital that I work in. This is a screenshot of Brainomix on a mobile phone, so it can be accessed from your mobile phone as well. And this is what the Brainomix interpretation of CT head looks like. As you can see over here, these are the 10 different areas on one side that make up the aspect score. 1, 2, 3, 4, 5, 6, 7, and there are 3 more MCA territory areas which are at a slightly inferior level compared to this image. You can see over here, this is the head of the caudate, the putamen, the internal capsule, the claustrum. 3 of the 6 MCA territory areas are visible on this scan, whereas there are 3 other areas that make up the aspect score, and they are at a different level, at a different axial section. As you can see over here, that the Brainomix has already identified that the putamen on the right side is affected, and therefore the aspect score is 9 out of 10. It has identified the area that has been involved by acute stroke. This is what the report of the Brainomix software looks like. It tells us that the total aspect score is 9 because the right lentiform nucleus is involved, and the area of the brain that is involved is represented by this red color, and as you can see over here, the area which is involved is red. It also tells you the volumes of the acute hypodensity as well as non-acute hypodensity. It also tells you if there is any hyperdense vessel, any large vessel occlusions or calcifications of large vessels. As you can see over here, this is the report of the CT angiogram by Brainomix. It tells you about the vessel density, the overall collateral score. In this case, you can see that the overall collateral score is 3. It tells you about whether there is any large vessel occlusion of the internal carotid artery, common carotid artery, external or internal carotid artery, and middle cerebral artery. Tells you about the arterial input function as well as venous output function. This is another screenshot of the report of CT angiogram by Brainomix. It tells you that the overall collateral score is 3. It did not detect any large vessel occlusions and the vessel density was 100%. There wasn't any internal carotid artery or middle cerebral artery occlusion detected. Collateral score was 3, and these are the different color codings of the different blood vessels that supply the brain. For example, this color represents our anterior cerebral artery, this color represents posterior cerebral artery, this is the color for the straight sinus, and this is the symbol for arterial input function. This is the symbol for venous output function. As you can see over here in this image, you see this brown one is the anterior cerebral artery, and as you can see, this is in accordance with the color coding legend over here. The brown one represents the anterior cerebral artery, the light green one represents the middle cerebral artery, and you can see over here the light green one is either the internal cerebral artery or the proximal middle cerebral artery. So you can see over here it is the proximal middle cerebral artery. Then the distal middle cerebral artery is represented by these light blue vessels, and you can see over here the light blue vessels represent distal middle cerebral artery. So it identifies all of the blood vessels automatically. It identifies any thrombus or large vessel occlusion automatically. It color codes them according to a color coding legend, as you can see over here, and it also generates maximal intensity projections or MIPs. This is the axial maximal intensity projection, this is the coronal maximal intensity projection, this is the left-sided, and this is the right-sided sagittal maximal intensity projection. And this plus symbol, as you can see over here, represents the arterial input function. As you know very well that this is the point where the internal carotid artery is entering the cranial cavity and then splitting into the anterior cerebral artery and the middle cerebral artery. So this is appropriate placement of the arterial input function, and this minus symbol represents the venous output function. And as you can see over here, this is the point of the straight sinus, so one of the venous sinuses, and once again you can see over here that this is adequate placement of venous output function. It is important to make sure that the arterial input function and venous output function are adequately placed, because otherwise the results of the Brainomix are not reliable. This is a phase assessment diagram. I'm not exactly sure what it means, but I can tell that it is about the various different phases of the study. As you can see over here, this represents not enough contrast, and then these different areas represent early arterial phase, peak arterial, then the equilibrium phase, the peak venous phase, and the late venous phase. And this is a screenshot of the results as displayed by the Rapid software. It tells you about the different areas that make up the aspect score, and if any of these areas is involved or affected. These are the time activity curves for CT angiogram as displayed by Rapid. This is the arterial input function. You can see this is the arterial curve, and this is the venous output function. This is the venous curve. Now, you have to make sure that the arterial peak comes earlier than the venous peak and also ends earlier than the venous peak. These two peaks should not be superimposed, because otherwise the findings of these scans are not going to be reliable. And this is a representation of the amount of motion artifact in all 3 dimensions, as represented by the degree of rotation as well as translation. These are the results of CT brain perfusion studies as demonstrated by Rapid. These are cerebral blood flow, cerebral blood volume, time to peak, and mean transit time. These are detailed cerebral blood volume maps, and you can see the areas of the brain that have reduced cerebral blood volume are highlighted according to this heat scale, according to this color scale. And at the bottom, the volumes of different areas of the brain that are less than a given threshold of cerebral blood volume are also mentioned. So you can see that 68 ml of brain has a cerebral blood volume less than 34% of expected, whereas 76 ml of the brain has a cerebral blood volume of less than 38% of expected, and so on. Similarly, these are cerebral blood flow studies, and these are Tmax, and this is a representation of cerebral blood flow as well as Tmax being displayed side to side so that we can compare between the two of them and find out if there's any mismatch. It also gives you the absolute mismatch volume and the mismatch ratio, and these numbers are important when deciding about whether a patient is eligible for mechanical thrombectomy or not. However, sometimes there are errors. For example, have a look at this screenshot. As you can see over here, that this report mentions that there is a hyperdense vessel of 5 millimeters in length, and it is demarcated over here, but you can see over here that this is not a hyperdense vessel. Similarly, this brown shading that you can see over here, if you look at the color coding, this brown shading means non-acute hypodensity. So it is demarcating this area as an area of non-acute hypodensity, but it isn't an area of non-acute hypodensity. It is just the Sylvian fissure. Similarly, in this particular patient, there is an anterior cerebral artery territory infarction. However, the aspect score mentioned by the software was 10 because the aspect score is heavily biased towards MCA artery strokes. The ACA artery strokes do not make up the aspect score, and so this is the reason why the Brainomix software sometimes ignores areas of hypodensity in the ACA artery territory. However, despite the fact that there are occasional mistakes, these artificial intelligence software packages are really very great at instantaneous interpretation of radiological imaging, that is CT head, CT angiogram, as well as CT brain perfusion studies in the setting of hyperacute stroke. Hyperacute stroke calls for instantaneous and rapid interpretation so that timely decision can be taken and the patient might be given treatment in a timely manner. Moreover, the thing with artificial intelligence is that it improves with the passage of time. Let me give you an example. When Google launched the feature of automatic subtitles in its YouTube videos, it was very pathetic in the beginning. Back when automatic subtitles started, you could clearly see that the performance was not very good. Most of the times the automatic subtitles could not figure out what the person was saying, and so this is why there were lots and lots of errors. But with the passage of time, it got better, and now there are hardly any errors in the automatic subtitles on the YouTube videos. This happens because artificial intelligence learns from its own mistakes. Every time the artificial intelligence system makes a mistake, the result of that mistake is fed back to the artificial intelligence software, and the software is penalized for it. There is a penalty for every mistake that the system makes, and the system is trained to learn from its own mistakes, to adapt, to modify itself, and to learn in an intelligent manner. This is exactly like a child learns. A child makes mistakes and learns from those mistakes, and the next time tries to do the thing in a better manner. As you can see over here, that like a fine wine, artificial intelligence gets better over time, and I've told you the reason why this is the case. This is also another diagram that explains the same concept. As you can see over here, that the machine learning algorithm has been designed in such a manner that it accepts input data and on the basis of that performs a prediction. Now, this prediction is evaluated as to whether it is accurate or not. If it is not accurate, then the results of this prediction are fed back into the model in order to train the machine algorithm even further. And as the machine learning algorithm gets exposed to more and more data, as it trains more and more, it becomes more and more accurate because it keeps on continuously modifying itself and becomes better at the task that it is doing. And as the machine learning algorithm is performing, it is learning at the same time. So it is a process of continuous learning, just like a child, and this results in the accuracy of the machine learning algorithm increasing over time. And this brings us to the end of our presentation. Thank you very much for your patience.